You are called to a private residence for an unknown medical aid.
All right. BSI, scene safety, PPE.
Your scene is safe and your gloves are on.
Okay, so penman, part of it is PPE, peepers, personal patients, partner, personal protective equipment.
That's not what P stands for.
Oh, it's not what it is?
Nope. It's just person, so it's saying MI safe.
Okay, person.
Yeah. So person, and then personal, partner, patient, peeper. Is it all of them? Yeah. Okay, cool. They're everyone's safe.
Environment.
No environmental hazards.
Number of injured.
Number of patients.
Number of patients. Mechanism of injury or nature of illness.
Unknown.
ALS. Is that what A is?
Yeah.
Okay, ALS.
What are you gonna do what about ALS?
Oh, so what was the mechanism?
Standby for ALS.
Oh, standby for ALS. Okay.
You can say standby, or I would recommend just saying I'm calling for ALS.
Okay, calling for ALS.
I would just recommend just that, just in general, just because standby can be like.
Oh, okay.
So I'll just recommend 100% saying we're having ALS en route.
Okay, ALS.
Just so there's no confusing, because that can be a critical fail if you forget that.
Okay.
So I would definitely just say, hey, we're probably gonna have ALS en route.
ALS, and then no need for extrication right now, just because it's, as far as I know.
No need for extrication, but what else does that N stand for? Extrication and you need to know this is for trauma. C-spine. Yeah.
C-spine, okay.
Yeah, that one's super specific for trauma, just because you're gonna need 90% of your patients for trauma, or they're gonna need C-spine. So.
Okay. So after that, the general impression.
Upon arrival, you find a patient sitting in a stool in a garage after mowing the lawn in a tripod position with difficulty breathing.
So I'm gonna check AVPU. Does he notice me walking up?
Patient tracks you as you walk up.
Okay, I approach them and do the person. So I ask them, is it person, place, time, person, place, purpose, and time?
You're asking the questions here.
Yeah. So ask, what's your name?
You're gonna ask me. Yes, my name is Sydney.
What's your name? And where are you right now?
I'm at home. I'm in my garage.
And why did you call us?
I'm having some difficulty breathing.
Difficulty breathing. Okay. And what time is it right now? Would you say?
Almost 7.
Almost 7. Okay, good to know. I forgot what the last C was for Jack.
What do you think it is?
Chief complaint. Okay, so your chief complaint.
Chief complaint not or and. Life threats.
Okay.
Yeah.
Complaint and like that. So your big complaint is just difficulty breathing.
I would ask, what is the chief complaint, and are there any life threats? I wouldn't want you to assume, because you could assume wrong and then have failure assessment.
Okay. So then I'm going to inspect airway. So is the airway...
well, ask me what my chief complaint and life threats are.
What are your chief complaint and life threats?
I do not have any life threats, and my chief complaint is difficulty breathing.
Just difficulty breathing?
Feel free to write anything down if you need to. That's what your whiteboard is here for. Is to write anything down.
Good. Breathe. All right.
But then it says not for medical.
No, you're not going to need C-spine for medical. You're only going to need C-spine for trauma.
Okay, but we still ask.
You're still going to ask for it.
Okay.
You're still going to ask for it, but you're not going to get any positive. You're not gonna, it's like the same thing. You're asking for extrication, but you're not going to get like 15 seconds. Yeah. Oh, sorry.
You can start.
Sorry.
Okay.
Well, either way, I'll take a minute off because we've been talking about it too.
ABCs. So I'm going to check first off airway to see is it open, see if it's maintainable, and if there is breathing.
Nope. Open.
Clear.
Same questions that you ask whenever you're doing your medium NRV. Same
Okay,
questions.
so is it open, maintainable, and clear?
It is open, clear, and maintainable.
And then breathing. So is the breathing? You see the respirations.
What is there's 3 questions you ask.
Rate.
Yep. Depth and quality.
Rate,
yep.
depth, and
Almost the
quality.
same exact ones as pulse, right? Pulse is rate, rhythm, and quality. This one's rate, depth, and quality. So you're gonna ask me what is the rate, depth, and quality of their breathing.
Depth and quality.
I'm gonna tell you their breathing is rapid and shallow. The rate is 26 per minute.
Little text box.
So this kind of one right there.
Yes.
Yes, absolutely. Yeah, you definitely want to write down the pace.
Yeah.
I've got that big.
You can write
It's the brand new one.
21 female for your dispatch information because they didn't give you any. Yeah, and then you want to write down the position they were found in.
I don't know how they remember in the field because they don't write shit down.
Practice. Years of doing it. Not years, but
A
definitely.
lot of them write it on their glove.
Yeah.
They'll just have a pen and just write it real quick on their
Yeah,
glove.
absolutely, yeah.
So.
And then their chief complaint.
And chief complaint. I have difficulty breathing.
Sounds good. Alright, you good?
So yes.
Alright, so the breathing is rapid and shallow with a rate of 26 per minute.
Okay, and then check. Move on to just
Nope.
note it.
No.
Oh, I actually have to give.
Any sort of breathing, you never want to move on a note it. You always
Okay.
want to try and treat it as best as you
Okay,
can.
so then I would apply back valve, not back valve, the
Best option.
That's not gonna work. You gotta tell me the
You see
name.
it 2%.
I know. High flow NRV.
Well, it's
Yep.
graded tomorrow, but.
How many?
How
I
many?
feel like you
How
did
many
pretty well
liters
though.
per
You
minute?
knew everything.
Well, it has 7,900
1,500.
Oh, God, no.
No.
That's
Okay.
how much is in the tank.
That's how much
What
is
are you
in the tank.
what are you
Yeah.
administering to them?
Okay,
At
so
least
it's
you probably-
5,
got it,
10,
right?
15, 20, 25.
that's one of
Those
those.
are your options. I'm giving you 5 options.
15.
Yeah, I'll say 15.
Okay, 15 minute.
Yep.
All right, and then I can move on to.
Now you can move on. Yes.
So circulation.
Yes.
I'm gonna check. Like skin color, is that one?
That is one of them. Yes. The skin signs are pale, cool, and normal moisture.
Oh, you said pale though. Pale, and then
Coughs.
Pulse.
It's coughs.
Coughs. Okay.
It's a C. Cap refill.
Oh yeah.
Cap refill is 2 seconds.
Cap refill 2 seconds. Okay, so that's not good.
That is good.
Oh,
That's normal.
Oh, sorry. I thought I meant it was longer than 2.
No, 2 seconds or less is good. That's what we want. Anything
Okay.
greater than 2 seconds, that's what we wanted to fix. That's when we want to treat for shock. Anything greater than 2 seconds, we're treating for shock. So 3 seconds or more, treat for shock.
Okay. I don't remember.
We talked about it
Obvious
earlier.
bleeding.
Obvious bleeding.
Oh.
Was there obvious bleeding? There is no obvious bleeding.
S signs of shock.
No, S is gonna be skin signs.
Oh, so P.
So P.
Pulse.
So what are the questions you have to ask for pulse?
So
It's almost the same as breathing.
rate, depth, and
Not rate depth. It's rate blank, and the third one's the same.
rate, rhythm,
Yep, and the last one's the same.
rate, rhythm, depth,
Quality.
quality, rate,
Rate rhythm and quality. Yep.
For circulation?
For pulse, yes.
Mm-hmm.
So the rate, rhythm, and quality of a rapid, weak radial pulse. That's a tongue twister. Rapid, weak. I just can't say that.
Okay. At this point,
I can't.
we're gonna load and go.
Sounds good.
All right, now I'm gonna check your sample. So, do you have S with signs?
S is signs and symptoms.
Signs
Yeah.
and symptoms. So, what signs and symptoms?
Shortness of breath and wheezing.
Shortness and wheezing.
Oh my God, see me! I haven't seen a jacket like that since like 7th grade. Like,
All right, and do you have any allergies?
allergic to latex.
Latex, noted. Change my gloves. And medications?
I'm on Proventil. Do you know what that is?
No, I do not.
It's an MDI. It's albuterol.
Okay, so albuterol. Past medical pertinent.
That's why I usually ask. Is like I don't like giving like the super medical names, just because not from them. Not everyone knows them. So like, if it's me, I'll be like, hey, do you know what that is? And they'll be like, no.
Will they be
what
like,
is this?
what is that? And you're like,
Well, like it just depends. If I was testing you, like I remember this was like last time I was testing. This is literally one of the ones that I had, and I was just like, oh, do you know what that is? Like it's they're on Proventil. Do you know what that is? And they're like, no. I'm like it's albuterol, and they would be like, oh, okay. And like if they don't know what albuterol is, they would shit out of luck.
Okay.
If you were to say the medication, would we be able to say what does that treat
What's
you
the last
for?
E in sample?
Yeah, you can totally ask me that.
Okay.
Absolutely.
The last
If you don't know, I would definitely ask like, hey, like what does that treat you for?
But like in these
Immensely
skills
helpful.
tests, say we have data, he's like,
He's not allowed to test you on skills
I
tests.
feel like they're
He's
just
not?
No, he cannot test you on skills tests.
oh, but like,
So
if
when
there's
they're
something
told
where
to
I
use
say,
them, I
okay,
can't
what
remember
Like I'm
what
passing
name.
the test, but then this comes around.
I would.
and it sucks.
I would.
haven't, like,
Absolutely.
do this, like-
I totally would. It's honestly if it's like a
I
super
bet you
block.
those
Because I remember
skills
like
days
another
are so
one is
hard to,
like
like,
a
actually
high
get
blood
shit
pressure
done.
medication that not everyone knows.
It's not
So, like a lot of
through
times
it,
if
it's
they
just
ask what that
learning
should be for,
the
then
skill
it's
itself, but not like how
My
to.
brother
Yeah,
just
for cops, it
went
has
through this and
vitals,
just
so
like
like
finished it.
bells,
Yeah.
I
bells are-
remember him
Yeah, bells are
studying
yeah,
this
you can
stuff,
take that
and
then
he's
too. It
like,
doesn't matter.
I don't even know. I gotta ask my stuff because
Okay.
you didn't like
Alright,
ask me for
ready?
any help or try to
Okay.
assess me
No.
something. You just like
And what's
you
your
watch me.
past or pertinent medical
That'd be
history?
easy.
I have asthma.
Asthma, okay.
That's why you should
Asthma. And then what was your last intake and food-wise? Or medication?
That's not what E stands for.
Oh.
No, industry we're on L, my bad. I had breakfast this morning.
Breakfast, okay. And then what were the events leading up to this moment right
I
now?
was mowing the lawn and I just got really out of breath.
Okay, so when did that start happening? Or how fast, excuse me, how fast did that start happening?
What do you mean?
When you were mowing the lawn, how fast did you run?
Use another word, don't use fast.
Okay,
Did that happen gradually? Did that happen suddenly?
Okay, gradually, with a
Because if you
gradual.
say how fast did that happen, I'm like, what are you talking about?
Well, yeah,
So it happened pretty sudden. It happened
pretty sudden, and then,
Peak.
I know. Provocation, does anything make it worse?
Or Better or worse?
better or worse?
Yeah. Sitting up makes it feel a little bit better.
Sitting better. Okay, and what's the quality of your breathing?
Just ask that in a different sentence.
How well are you breathing?
No. So when you quality, you want to ask like, just can you describe how you're feeling?
Okay, can you describe how you're feeling?
So if they still don't really know, like, does it feel like is it
like I
like
have this
achy?
page.
Is
I
it
don't know where it
pain?
went.
Is it like a stabbing? You kind of want to like give them those like
Okay.
adjectives to kind of help them out a little bit.
Okay.
You're gonna ask. I feel like tightening and squeezing within my chest.
Okay, does the chest pain radiate anywhere, like to your shoulder, or?
No, it's just in my chest.
Okay, and how severe? Like, is it the worst pain you've ever felt on 10, or is it
So you said it right, but it just kind of came off to the ear wrong. So rephrase it.
on a scale of 1 to 10? Is it the worst pain you've
10
ever?
being what?
10 being the worst pain you've ever felt.
It's about a 7 out of 10. So
10.
whenever you're giving that scale, you always want to give like 1 out of 10, 10 being the worst.
Okay.
And try and
And how long ago did this start?
about 45 minutes ago.
About 45 minutes ago. Okay, well, I'm gonna check your vitals just to make sure.
I'll give you this side.
And we don't ask for vitals, we're gonna take them.
You're gonna take my vitals, and then you're gonna tell me what my vitals are, and then I'm gonna tell you what your patient's vitals are. Does that make sense?
Yes, you're checking to make sure you can take vitals, and then you're also
Absolutely.
going to give us what is actually
Yes,
identified.
absolutely. Yes, thank you. You worded that so much better than I did.
No problem.
Go through we're gonna like auscultate here.
Yeah, honestly, like if it's up to me, because like, honestly, like if you also take too much, like or like it's like deep, having like 8 deep breaths in a row, like I'm just like just tell me where you would, and then like I'll count it. Just because like I don't want to be taking 8 deep breaths, because odds are I'm already gonna have a headache from that morning, so I don't want to have like an even worse headache.
Are we doing, when you auscultate, are we doing all squats on back end?
You're just gonna show me where you do it on the front and back. So you're gonna be like here, there, on either side over
Little
here,
tight.
and then show me where you do it on the back, and then I count
And
that.
get us up to about
We didn't
200.
even go over that.
Where to auscultate?
Yeah.
I'll show you guys after. I'll stop it and I'll show you.
Do you want to teach a class on Wednesday?
Do great.
We probably all show up.
I'll do like a final review.
There you go. Yeah. All right, we're going to cookie sense, everyone.
Yeah, we didn't have a final review. Like
Dude.
this
Monday
says
should be
final
review.
review, and then
Today?
Monday should be review.
No,
They should
Monday.
go through
Oh damn.
fucking everything.
I would ask David because I'm pretty sure you guys have class every day.
That's when I got 130 over
If
76.
so, there's nothing for it.
Write that down.
You don't need to write it down.
Alright.
I'm gonna tell you what your patient's vitals are.
Okay.
So you're just gonna take my pulse and then my respiration. And then
Oh, I know, it's.
Why can't we? Go ahead.
I'll stand back that or take it Wednesday.
Right? I know. Like, why can't we? Yeah, just like take it on Wednesday and have the final review on Monday.
I like have asking like females to do this too.
Your pulse is 84 right now. And respiration.
I didn't have to Thursday off for not doing that.
Colin sick.
I know, I should.
Just go in.
12 for respirations.
Sounds about right.
Alright, and let me just check your lungs.
Just show me where you would.
So, above your, right there, upper heart, other side, lower, upper back, lower back, upper back, lower back.
I'll show you guys because I need to show them how to do it. So I'll show them how I learn. Everyone learns it a different way. I learned it differently, but I mean, as long as you hit all four of
If I was like
yeah.
even slightly,
So-
It's everyone
if I was
learns.
even
I
slightly,
take it when I auscultate, I hear wheezing.
You know what I mean?
Yes, when you auscultate, you hear bilateral wheezing. Your vitals, your blood pressure is 138 over 54. Pulse is 120. Respirations are 26. I would write this down.
Okay, so here, that.
Blood pressure is 138 over 54.
138 or 34?
54. Pulse is 120. Respirations are 26.
Okay, you're breathing fast. My first impression is asthma attack.
Did you do your IPA?
Oh, IPA, so inspect.
Yep. When you
Oh.
inspect, you see shallow respirations that are also rapid.
And then where am I going to palpate?
You would palpate.
But what would I palpate?
You'd palpate the lungs and the ribs primarily for feeling for like crepitus, any sort of like instability. That would where your decap BTLS would come in.
Okay.
But you're not really feeling for that. It's only like you're just kind of feeling that. Most likely, it's like for medical assessments, it's gonna be nothing noted.
Okay, so then palpate lungs. Or
Yep, or not palpate the chest area, and then for auscultate, you hear bilateral wheezing.
bilateral wheezing. Okay, so field impression is asthma attack.
Okay, how do you treat an asthma attack?
So that would be, I'd ask, do you have an inhaler?
I
Or-
do have an inhaler,
Okay, so,
because I'm on Proventil.
okay, Prevental, so do I need to call medical control first?
Yes.
Okay, medical control.
Always
I'm
call
gonna
med control.
radio them and say, we are going to have our patient take a deep breath with their inhaler. So after do they have to give you a thumbs up?
You're gonna ask medical control for permission to give your
Okay.
inhaler.
So permission.
To like, if it was me, I would be like, I'm gonna call medical control to ask for permission to assist my patient with their prescribed albuterol. That's
Okay.
I would say, like, word for word.
Okay, ask for a prescription. And
And then they're gonna say yes. They're not gonna say no.
okay, so I'm now going to give you your inhaler.
How would you
and-
give me my inhaler?
So I'm going. Do I have to hold it, or do you?
Tell me how you do it, and I'll tell you after.
Hold it in front of you until you inhale, and as you inhale, push down the button.
I would do it differently. I would
Okay.
do it like you first. You have a test puff to make sure there's actual medication in it.
Okay.
Test puff.
I need to actually inspect the can.
Yeah, so you're gonna do your D dice and your 6
Okay.
now too.
So
Yeah.
D dice. So 6 rights, right medication, right patient, right dosage, right documentation. There's two more.
Right route.
Right route,
One more. What is it?
right time,
All right, D dice.
D dice, discoloration. Get the second D.
Right dose.
Right dose.
Right dose. D's not discoloration. What's the second D? Drug. Yeah, right dose.
Oh,
Right
drug.
drug.
Drug
I
dose.
indications. C contraindications and color clarity, and then E is gonna be expiration.
Okay.
Yep.
So check that.
I wrote those down on flashcards to help you remember it.
Okay.
And then test puff. Put it up to the patient's mouth. Have them take a deep breath. Hold down for how many seconds? Is it 5? 10? 10? Okay, just kidding. 10 seconds. 10 seconds. Inhale for 10 seconds. Have it. Inhale. Remove it. Inhale. Take a deep breath out. All
They
right.
said you're supposed to hold it for 10 seconds.
Yeah.
And you do the other 12 and
Yep.
So it'd be 2 puffs.
Yep.
Okay.
All right.
So then,
How often would you reassess this patient?
um, 5 minutes?
2.
2. Oh,
Respiratory is always 2 minutes.
okay,
Always.
respiratory is
Respiratory is 2 minutes. Anything else is 5.
2. Okay.
Yep. All right. Do you want a second set of vitals?
Yeah. Do I have to take them or?
Nope. Nope. You're only taking it for the one time because I don't want my arm to go down.
Yep.
Blood pressure is 130/68. Pulse is 112. Respiration's 20.
So that is normalizing. So now I'm going to call the radio and
Yep.
Oh.
What's your radio report?
radio report. We have a 21-year-old female with the chief complaint of difficulty breathing. She was found in a tripod position in the front yard. Is that right?
Yep.
And do we have vitals? Is that right?
Yep. Vitals.
Okay, vitals were respirations or blood pressure was 138/54. Pulse is 120. Respirations were 26 a minute. Let's see.
Interventions.
Okay, interventions. We gave her
Chief
inhaler.
complaint and interventions.
Okay, so chief complaint was asthma related.
Chief complaint was difficulty breathing.
Oh, okay, difficulty breathing. And intervention, we gave her albuterol or
We gave her 1 dose of her prescribed albuterol.
1 dose of prescribed albuterol,
And then ETA.
and we will be there 5 minutes.
Sounds good. Alright, so that was 15:20. The
What's
time.
the time
You said you
now?
took a minute off the.
Yeah, but I was also stopping and talking the entire time. And I forgot to start it again a few times.
Yeah.
So that was 15:20, and you see how much we stopped and we talked about stuff. So it does go by really fast. With this skill, I would definitely say make sure you kind of memorize I feel like if you memorize the board that I sent you guys should be fine. Like, 'cause then you can kind of like, because then it's literally gonna tell you word for word like what to go by, you know? Yeah. Okay. So when you're auscultating for lung sounds, I'm gonna use these as you're standing up. I was taught 6 places. So there's 3 lobes in the lung. I mean, there's only 2 lobes on one side, but since there's relatively 3 lobes in the lung, you're gonna go here. It's like right above the nipples, right below the nipples, and then right on the sides over here. So it's gonna be like 1, 2, 3, 4, 1, 2, flip around. And then for the scapula, for the back, you're gonna pretty much do the same thing. You want to try and hit all 3 lobes on the back. You never want to go over the scapula. You're not gonna be able to hear anything through there, so you're gonna essentially line the scapula going out. So 1, 2, 3, 4, 5, and 6. Yeah. I know only one of them has 2 lobes, but we're gonna do it equal on both sides. Make sense?
Yes.
A lot of times, I doubt with your medical assessments they're actually gonna make you auscultate. They might just tell you where do you auscultate, most likely.
You just say
There's
above
and then
nipple, below nipple on the
yeah,
sides
or
of the
no,
ribs.
you're gonna point.
Oh, okay.
You're just gonna point. Yeah. Make sense? Can I erase this?
Yeah.
All right. Any questions about that one? That's a pretty common one that you guys will most likely see on your test day.
What is most common?
This one, anaphylaxis is really common. Last test day, I saw a lot of pneumonia. That was one that I got a lot. But yeah. Okay, who wants to go next?
You know
I was
your
about to say you're gonna go
acronyms.
next.
I would go if I knew my acronyms a little better.
That's why I like writing them down, because then you don't have to memorize it. You just remember what each letter stands for, you know? Like,
No, I just can't find a place where all of them are. Like all of them for everything.
There's a decent amount there.
Yeah, that one's
it should be in the
online,
handbook.
but-
Yeah, that
It
one.
doesn't have everything.
But it
though.
doesn't have everything.
Like, what does it not have?
It doesn't
Well,
have
look,
D
there's only,
dice.
I feel like there's so many freaking acronyms,
Yeah.
and there's only.
I feel like that's all the ones I needed.
Really?
I thought
I
you-
went
I
through.
thought
Yeah,
you
because I
guys were
had
talking
Andrews, and I had that exact same.
I thought you guys were talking about D dice and IPA.
Oh,
and
well, that's
shit like
different.
that.
Well, see, that's what I'm trying to
So do you
find
want me to?
something.
I don't
that
think
has
they're gonna find a
all
sheet
of
that has
them.
every single one.